as lifestyle becomes more stationary and dietary habits shift. The incidence of diabetes has surged. Hey there and welcome to our channel. Today let's have our introduction and types of diabetes. Diabetes. Diabetes mellitus is a multifactorial metabolic disorder characterized by chronic high blood sugar hyperglycemia that interferes with the metabolism of carbohydrates, fats and proteins due to inadequate insulin secretion, inadequate insulin action or both. Characteristic symptoms: thirst, polyuria, blurring of vision, and weight loss. In severe forms, ketoacidosis may develop and lead to stupor, coma and in absence of treatment, death. Long-term effects include progressive development of retinopathy with potential blindness, nephropathy to renal failure, neuropathy lead to foot ulcers, amputation, Charcot joints, sexual dysfunction. Diagnosis. Diabetes should never be diagnosed based on an individual's asymptomatic blood glucose level. At least one plasma glucose result with a value in the diabetic range is essential. If such samples fail to confirm the diabetes, it is advised to do the test again until the diagnostic situation becomes clear. Other than tests, some additional factors are also taken like family history, age, ethnicity, and concomitant disorders before the course of action. Glycated hemoglobin giving average glycemia over a period of weeks was thought to provide such a test. In children, usually presents with severe symptoms, very high blood glucose levels, marked glycosuria and ketonuria. How the insulin works to lower the glucose. The pancreas produces insulin, a chemical that is necessary for the body to maintain a healthy blood sugar level. Carbs are substances that the body uses to generate energy after consuming food that contains carbohydrates. These carbohydrates are then transported to the small intestine, where they are broken down into individual sugar molecules known as glucose. The cells in the small intestine absorb the sugars that pass into the bloodstream. And when the blood reaches the pancreas is able to detect the high level of sugar in the blood. In normal circumstances, this leads to the release of insulin into the bloodstream, which helps to reduce the blood sugar level to a safe level. As the blood flows through the body, insulin and sugar pass through the bloodstream into the tissues to reach the cells. Most cells possess structures on their surface known as insulin receptors. When insulin passes through the bloodstream and attaches to the receptor, it acts as a key in the cell, allowing the sugar to enter the cell. This allows the cell to use the sugar to generate energy, which is essential for proper functioning, and the blood sugar level returns to its normal range. Classification. The 1985 classification was widely affected and is used internationally. Three major types of diabetes mellitus: insulin-dependent diabetes mellitus (IDDM), type 1 diabetes; non-insulin-dependent diabetes mellitus (NIDDM), type 2 diabetes; gestational diabetes mellitus (GDM), type 1 diabetes, also known as autoimmune diabetes, chronic disease characterized by insulin deficiency due to pancreatic beta cell loss. IDDM presents with prominent diabetes symptoms and extreme hyperglycemia. A person with type 1 may be functioning normally prior to the onset of clinical disease. However, the beta cell destruction process can be identified. Pathogenesis is thought to involve T-cell mediated destruction of beta cells. Islet targeting autoantibodies that target insulin 65-kDa glutamic acid decarboxylase, insulinoma-associated protein 2, and zinc transporter 8 all are biomarkers of T1DM-associated autoimmunity. The pathogenesis can be divided into three stages: appearance of beta cell autoimmunity, normoglycemia, and no symptoms; beta cell autoimmunity, dysglycemia, and no symptoms; beta cell autoimmunity, dysglycemia, and symptoms of diabetes. Type 1 diabetes can be used as a reference for autoimmune diseases that affect certain organs, like celiac, thyroid, and Addison's. Type 2 diabetes. Common form of diabetes and is characterized by disorders of insulin action and insulin secretion. NIDDM diagnosed by presence of classical signs and symptoms of diabetes together with perfect elevated blood glucose levels. Gestational diabetes. Carbohydrate intolerance leads to varying levels of hyperglycemia with onset or first detection during pregnancy. High fasting or postprandial plasma sugar levels at this point in pregnancy may be indicative of diabetes that has delayed pregnancy. But criteria for identifying abnormally high glucose levels at this point have not yet been determined. Criteria for GDM vary but require an oral glucose challenge and measurement of post-load plasma glucose. Thanks for watching our video. For more, please do like, share and subscribe and hit the notification bell for latest updates.